Often when we think about cirrhosis of the liver, the first thing that comes to mind is alcohol. And yes, alcohol for the longest time used to be the #1 cause of liver damage and cirrhosis or end-stage liver disease. But notice I said used to, because unfortunately there is a new kid on the block, and that is called fatty liver disease. And this can impact almost 1/4 or 25% of the US population. And the issue with fatty liver disease is that it does not cause any issues until it's too late. It is the most difficult thing for people to understand because they don't realize that they're suffering from a condition that really has no symptoms. You may be thinking, hey doc, how do I fix a condition in which I have no idea what is going on? Well, you're in luck, because that's why you're listening to your poop guru, so I can let you know what exactly you need to do. Howdy y'all, Dr. Samir here, aka your poop guru, trying to give you the best tips and tricks so you can live your best life from the top all the way down to the bottom. In today's video, we're going to talk about fatty liver disease. What is it? What causes it? And I'll give you 4 tips at the very end to fight off this fatty liver disease, keep it at bay, so you can have a happy and healthy life. Guys, let's talk about poop. So I'm going to tell you about a patient of mine named Jasmine. Now, Jasmine was an individual who came to see me who ended up having fatty liver disease, and she had no idea. Her doctor got routine blood testing and noticed that her liver enzymes got elevated, and she did not know why. So she came to see me, and I saw that she had some of the risk factors for fatty liver disease. She was obese, she had a lot of fat around her belly, she had diabetes, didn't exercise, and had a terrible diet. And I could see where this path was going to lead, and I knew that if we didn't have some sort of intervention, she was end up having liver cirrhosis, liver failure, and maybe needing a liver transplant. So we really got into the weeds of what we can do to help her out. We adjusted her diet. She went to go see a trainer. She joined a gym, started walking, changed things, made a complete 180 turn. And after a couple months, guess what happened? Her liver numbers went down to normal. She lost weight, felt better, and we pretty much eliminated her risk for developing fatty liver disease and liver failure. So what exactly is fatty liver disease? There are a couple different definitions you should be aware of. One of them is NAFLD. This is non-alcoholic fatty liver disease. This is the umbrella term for fat that goes into the liver. And once again, because it's non-alcoholic, these are individuals that have fat in the liver that's not due to alcohol. Now you may be surprised, but alcohol can also cause fat in the liver, and sometimes when we do imaging like an ultrasound or a CAT scan, we can see fat in that liver, and we're not quite sure if that fat is due to just fat around the belly or actually alcohol. Now if you exclude alcohol, that umbrella condition is called NAFLD. Now a healthy liver typically has a small amount of fat, but when that fat takes up about 5 or 10% of the liver, that's when you can start to see damage and see that fat on imaging tests. Now your liver is an important organ and it performs a lot of critical functions. Number 1, it produces bile, which can help out with digestion. Number 2, it makes proteins for your body. Number 3, it helps to store iron. Number 4, it converts nutrients into energy. Number 5, it creates substances to help you clot and to close off wounds and cuts. And number 6, helps to detoxify your body to get rid of toxins and inflammation and infections so you don't have to worry about them inside your body. So as you can see, your liver plays a critical role in maintaining your everyday health. And if that role or your liver gets impaired, it can have devastating consequences for each individual that has liver issues. Now I'll tell you, the vast majority of people that have fat in liver, not a big deal, doesn't cause any issues. But about 1/3 of them over time will progress into liver failure, and that's where the damage really is. And there are 3 main stages of this progression. Number 1 is when your liver becomes inflamed and swollen, it becomes what's called steatohepatitis. And that's actually when you have damage in the tissue of the liver. Number 2, after damage, you form scar tissue, which in turn is called fibrosis. That can be reversible, but at this point in time, you're getting to a point where you're heading towards the end stage liver disease. And number 3 is when you have extensive scarring of your liver. And by the time you hit this point, you've already hit the point of no return, and that's when you have cirrhosis. And at this point in time, your liver cannot go back to normal. The scarring is there, it won't get better, and we have to see what we can do to manage the complications from liver cirrhosis. So my goal as a GI and liver doctor is to do everything I can to make sure we don't hit that stage of cirrhosis. Because once you're there, the only treatment is a liver transplant. So who's at risk for developing fatty liver disease? Well, number 1, obviously you have alcohol. That is a different category of liver disease, and so you need to stop that. But for non-alcoholic fatty liver disease, if you happen to be Hispanic or Asian, that tends to put you at a higher risk. If you have obesity, especially central obesity, you're at higher risk. If you have other complications from obesity like diabetes, heart failure, high blood pressure, history of strokes, this can increase your risk of developing liver failure as well. And unfortunately, the vast majority of people don't realize that they have fatty liver disease until it's too late, because in the vast majority of cases, it does not cause any issues, signs, or symptoms. You have to be proactively looking for this to see exactly what is going on. However, for some people, they may have this vague pain on this right side where your liver is at. For some people, they can have some discomfort that's there. Maybe over time, they notice that they have some spots on their skin, having yellow eyes, yellow skin, having really red palms called palmar erythema. And over time, as your liver progresses, you can get confusion, swelling your belly, and you just have some protein wasting as well. But by the time you hit that, most likely you already had liver cirrhosis. So what are things you can do today to prevent your risk for developing liver cirrhosis? And what can you do today to reverse the damage? Because you may not realize this, but before you get to cirrhosis, we can reverse the damage and make it back to normal, just like I did with my patient. Here are 4 tips I recommend. Number 1, you have to maintain a healthy weight. If you notice you're getting fat around the belly, or you have risk factors for obesity, get on a program to lose that weight. Speak to your doctor, go to the gym, take a walk, try apps like MyFitnessPal or Lose It. These things work, they're excellent, and if you can lose that weight, that is going to be the best thing you can do for your liver and for your overall health. Hey, if you're getting great value from this video, I really would appreciate it if you smash that like button, comment it down below. Number 2, get off the couch and go for a walk. Exercise, exercise, exercise. Even if you exercise without losing weight, the physical act of going out and doing some exercise is going to decrease the inflammation in your liver, improve your antioxidants, and reverse the damage that can occur with fatty liver disease. Number 3, adjust your diet. Okay, we know the foods that can make liver damage worse. You know them, I know them. I have a video that I talked about this as well. But basically, highly processed, ultra pasteurized, high carbohydrate type foods can make your liver disease worse. Try to eliminate or minimize those. Pizza, pasta, tortillas, potatoes, cookies, chips. You know the drill. You know what I'm talking about. It's pretty obvious here, guys. And on top of that, minimize the number of meats, or even in fact, do what my patient did, which is go on a vegetarian diet. It works, it's fantastic. And of all the diets that are out there to improve your liver, a vegetarian or a Mediterranean type diet tends to be the best. And number 4, even though it's non-alcoholic fatty liver disease, if you drink alcohol, it's not going to make things any better. So cut back on that booze. If I were you, I would completely eliminate alcohol or minimize it so much where it's not part of your everyday life and you don't have it affect your liver. Any little bit will help. And if you can't completely eliminate it, at least minimize that alcohol. Guys, I know I probably scared the living bejesus out of you, but here's the deal. The good thing about your liver is that it can be completely reversed until you get to the stage of cirrhosis. So you can do it today, improve your liver, get it back to normal, and enjoy a regular, fulfilling life. So here's what I want you to do. This week, if you had some of the symptoms I described, go see your doctor immediately and get your liver checked. If not, how about just be proactive? Use water or drink water instead of alcohol. Go for a walk. Eliminate those trigger foods. Do these things that are healthy for you and for your liver. Take your health in your hands. Make that step and get your liver back in shape. So my question today for you, what tips would you add to improve your liver? What would you change? What questions do you have about your liver? Comment down below. I would love to hear what you guys have to say. I want to thank you for watching. Don't forget to smash that like button. Like, share, and subscribe, because if you subscribe, you'll be able to get my liver protocol and review my recommendations from a true liver specialist on what you can do to reverse your liver. Guys, I want to thank you for watching. Don't forget, let's talk about poop. Thank you, everybody.